Meanwhile, why are we giving up on our debt going up? Because we're close to cracking the $18 trillion level. And if Hadley Heath is right, something is going to send that up even more. Hadley, what will that be?
We're talking about the Medicaid expansion in the Affordable Care Act, Neil. In their last 10-year cost estimate, the Congressional Budget Office estimated that $792 billion federal tax dollars would be spent on expanding Medicaid. And now we're seeing a new trend among employers who are preparing for the employer mandates to take effect in the Affordable Care Act starting January 1st for businesses of 100 workers or more. If employers can shunt their low-wage workers into the Medicaid program, they don't face the same penalties as employers with maybe employees who go into the exchanges.
You know, you hear an argument back and forth on this that, you know, this is costing a lot more money than anyone thought. But it's not as if they just stop it. I mean, they just have a way to keep it going. And if you have to go into the red to keep it going, you go into the red to keep it going, and on we go. But this could substantially impact deficits going forward, to say nothing of the accumulation of them, our debt.
That's right. And if you look at other big drivers of our debt, you see a lot of them fall into the mandatory spending category. They are entitlement programs like Social Security, like Medicare, and now, of course, Medicaid, with the millions of new people who will be insured through Medicaid because of the Affordable Care Act. And what's striking about this expansion, if you look at a study from Boston University and the Harvard Medical School, is that they predict that about 80% of the people who will be newly insured in the expansion population were previously privately insured. So not only are we moving these people into a public cost column, but we're also potentially putting them in a position where they have reduced access to health care services. Medicaid traditionally has not provided the same quality of care or health outcomes as private insurance.
Hadley, thank you.
Thank you.
Well, here's what the government does want to trim the fat from us, or at least our waistlines. How? By paying workers to lose weight.